Hi everyone, this is just a quick coronavirus update. There's a lot of news and information just coming out the last few days, so I thought it would be nice to share it with you and we can be all educated together. So the first one is that the Center for Disease Control, or CDC, is ready to distribute the first coronavirus vaccine here in the US made by the pharmaceutical company McKinnon. And it will be distributed to doctors' offices and community health centers starting end of October or the first couple of days in November before the election. And this will just be given to healthcare workers and the high-risk individuals. So I'm quite excited about this just to see the results and if it's really working and if there are no complications or side effects. But I am really looking forward to this, and I'm crossing my fingers that this will work. The second news is that the Glaxo, Kline, and Sanofi, all big manufacturers of vaccines here in the US as well, are already testing vaccine. They are ready to share the results of their testing first week of December. So there's another second alternative, which is really good. There's also research down in the university in San Francisco where it's a nasal spray. They got the idea with the llamas, the animal llamas or something like that. The idea is that they inhibit the protein, the spike protein of the virus, not to enter the cells of the humans, thus preventing the infection or the disease. So let's wait for that too. I'm really hoping that they will go to like the stage 3 of testing, like really test it to the humans, not just in the labs, make sure it's safe to use. And I'm hoping that these companies just be prudent and do the right thing before coming out and distributing it to the public. The other thing, President Trump just appointed a new coronavirus leader to replace Dr. Fauci, and that is Dr. Scott Atlas. He is a radiologist and he's a professor and a fellow at the Stanford University and a member of their Stanford University Virtual Institute. I don't know how, I can't say much about him because it's a pretty new appointment, but I like that one of his priorities is educating American kids. And although the American kids are low risk, but I think educating them, especially with the reopening of the schools in September. So I like that. And he's he doesn't believe in the use of masks to protect from the virus. He's one of those that believes on herd immunity. It's HERD immunity. That is that it has to have a bigger population to has an immunity with the virus or any disease to fully eradicate or diminish that the spread of this virus or any contagious infectious diseases in the future. So he believes that through vaccine, of course, and natural infection where the patients will get the virus and will get off and be healed or get off of that, and so already has the immunity, so it will not infect another person. So but then it says that it requires at least 95% of the population to fully eradicate or for that virus not to be infectious anymore. So let's wait and see for that as research and all. I am hoping that the Labor Day celebration coming soon, that people will still continue to be alert and be respectful of and really practice social distancing and using the mask and be very careful. And so we will not, the cases in the US still high and it's still real out there, so I hope people will be very responsible. So I'm hoping that people will do that. In New York, The malls will be reopened starting September 9th, but the restaurants and the dining out is still on hold. So there are a lot of good steps towards normalcy. And even when I go out and into the beach and public areas, I see that there's more people there and more kids, at least more than the last time I did my video and went around and checked these public places. So there's, I guess, that confidence that it's a little, from the people, that it's getting a little better. And so they're also like confident to go out. It's still not the same, but at least there's more people out there, more cars, I noticed. And the banks are open now without any appointments. So that's a good thing. So I think we're on the right track. Continue again to be vigilant and do our part until we hear it from CDC or from Department of Health and from the leaders that we're okay to not wear masks and to have those socialization with a lot of people. We should still be mindful and be alert. We are all in this together, and I know that this soon will pass, and we have to remember the learnings, and that we're better than we used to be. When we have this pandemic or anything catastrophic or crisis that will hit us, always the one thing that we have to ask, what are our learnings, so that it will be better the next time when this happens, or go back to the answer of that we'll be better than we used to be. So those are the updates for now. Thank you for watching. Please don't forget to like and subscribe, and till the next time, take care everybody, and God bless.